Hi there everybody, I'm Lauren Bell. I'm a cognitive behavioural therapist and I specialise in treating a range of common mental health problems such as depression and anxiety disorders. Some of you may know me as the Yorkshire Therapist. So the purpose of today's video is to talk to you about and share with you a specific therapy technique called worry awareness training. And this comes off the back of the 2-minute mind hack that was shared on BBC Radio Sheffield this morning, which talked about worry awareness training specifically. So the idea with worry awareness training is that this is something that we use in therapy to help people who are experiencing excessive hypothetical what-if type worries. These hypothetical what-if type worries are very, very common within a problem called generalised anxiety disorder, but are also kind of normal for us all to experience at some point. And given the fact that we are currently in lockdown again and we are living through an ongoing pandemic, it's normal that a lot of us will be starting to notice an increase of worries of this sort. So what I'm going to share with you here is basically a little bit of a diagram which looks at the cycle of worry that we can all get caught in. So basically, when we're feeling anxious, we are subject to different situations. So situations can be literally anything really. So these situations very quickly start to promote or prompt what if type thinking in our brain. So I always say to my patients, thinking what if in itself isn't necessarily a problem. It's something that we all do and it's a normal part of human thinking. However, what happens is if these what-ifs become excessive or they become increasingly problematic, is they will very quickly start to spiral out of control. So rather than just being a fleeting what-if thought that pops into your head and then pops out, very quickly that what-if will then escalate into what we call worry. So when we think of worry, I always explain this as it's like a mental process that happens in your brain. So your brain takes a scenario, it thinks what if about it, and then it kind of chains from one thing to another. So one what if will lead to another and to another, and then before you know it, when you're worrying, you're playing out different scenarios in your brain, you're thinking of the worst case scenario, and before you know it, you're feeling incredibly anxious and stressed. So this here is like the first start of the worry cycle. And then once we're starting to feel anxious and stressed, both physically and emotionally, over time, this can lead us to feel absolutely demoralised and exhausted. So we feel absolutely wiped out and just absolutely, knackered, basically. So the more demoralised and exhausted we feel, though, the more vulnerable we can then be to be triggered off by situations in the first place. So we're seeing this a lot kind of with us being in a prolonged lockdown. So we're starting to feel kind of, our resilience levels are low. So we're feeling more exhausted, more demoralised, and then that means that we're all a little bit more prone to be triggered off by things that maybe in the past we would have just brushed off. So worry awareness basically comes in and it intervenes at the top of this cycle here. And so the idea is when we're kind of anxious for a prolonged period of time, our brain starts to become more threat orientated. So it starts to interpret more things as a threat. And the more we start to see things as a threat, the more we start to believe that the things that we're thinking about in our brains are true and real. The problem with this, however, is that our brains then start to become confused, and rather than being able to tell the difference between current problems, which actually do not need our attention and do need to be solved, and hypothetical problems which may never happen, your brain starts to think everything is a current problem, and that then increases and elevates the threat system, which drives and fuels anxiety further. Worry awareness training targets these what-ifs. So we want to, by doing this technique, help your brain to be able to tell the difference between current and hypothetical worry again. And the idea is if we can help it to establish and tell the difference between these two states of worry, that will then slow this process down. So rather than a what-if kind of escalating into this kind of cycle of worry, if we're able to kind of flag up to your brain straight away that this is actually a hypothetical worry and may never happen, that will prevent the rest of this cycle from happening and then can alleviate and lower the levels of anxiety that you feel. So to do this, you would complete one of these worry diaries here. And what I will do is I'll upload a picture of this, so you can do your own version on your phone. Or if you want a specific kind of electronic copy, you can email me which is the yorkshiretherapist@gmail.com, and I will happily email you out an electronic version which you can use. So this here is a worry diary. So to complete this worry diary, what I want you to do is put an alarm on your phone for 3 times a day. And when this alarm goes off, I want you to stop what you're doing and then ask yourself, what am I worrying about now? What I then want you to do is write that worry down into this box here. So write down what the content of that worry is and what it is specifically that you're worrying about. Once you've done that, I then want you to rate how anxious that worry is making you feel on a scale of 0 to 10. So 0 is not anxious at all, and 10 is the most anxious you've ever felt. And then finally, the third thing I want you to do is there and then in that moment, is I want you to ask yourself this question. Is this worry current or is it hypothetical? So a current worry would be something that has happened or is definitely going to happen. So for example, my car has broken down or I have got coronavirus. Whereas a hypothetical worry would be something that may or may not happen. So what if my car breaks down or what if I get coronavirus? So once you've written that down and you've classified the worry, be careful and do make sure that you do classify it, because if that's the really important bit really. So classify the worry, and then once you've done that, I want you to then try and get back on with what you're doing and try and distract yourself from what you were thinking about. And then the next time the alarm goes off, complete the log again. You only do it 3 times a day, because if you do it more than 3 times, it can get a bit excessive. And then what you can do at the end of the week is, once you've completed this, is you can go back to this and you can reflect on the worries that you were having. And then you can actually start to reflect on how many of these worries were actually current or hypothetical. What we'll hopefully find is that a lot of them were hypothetical. And just in doing that, and just in kind of repeatedly flagging that up to your brain, we should notice that it starts to really cotton on to this. And like I said to you a little while ago, rather than those what if or hypothetical worries spiralling out of control, if your brain is able to very quickly flag up and establish that it's hypothetical and may never happen, it'll disengage it from that worry process, and that in the long run will start to make you feel less anxious and less worried. So that's worry awareness training in a nutshell. Like I said to you earlier in the video, if you want access to this sheet electronically, just drop me an email. Or if you've got any questions and queries, by all means comment on this post or ask me anything directly, and I'll be more than happy to help. So thank you very much for your time today. Thanks for watching, and speak to you again soon. Bye-bye.